Hello everybody, how are you? I hope you're doing well. I hope you have a nice day. Today we will talk about macrodontia. It's our another topic. So macrodontia, what is macrodontia? It basically means the teeth whose size is larger than normal. So macro mean large, humongous, and dontia mean basically the teeth. So the teeth whose size is larger than normal, they are called macrodontia. Okay. There are many causes, but some of the famous causes of macrodontia, or it may be associated with some disease or syndrome or hormonal imbalance. The example is gigantism, otodental syndrome, insulin-resistant diabetes, facial hemihyperplasia, and exposure to radiation and toxin. So these are some few examples that can lead to macrodontia, or macrodontia may be associated with any of these diseases. Okay. Now, macrodontia, they have also three types. As for macrodontia also has three types. Number one is generalized, the other is relative, and finally it is the localized. Each and one of them. So our first type is generalized macrodontia. So generalized macrodontia is a trait, is a feature in which the entire dentition in your oral cavity is of larger in size, meaning each and every tooth in your oral cavity, they are larger in size. Okay, they're seen in example like gigantism or a syndrome called Rebsen-Mendenhall syndrome. Okay, these are two examples in which generalized macrodontia can be seen. The other type is relative macrodontia. It basically means that a condition in which the teeth are of normal size in 3D, in height, width, depth, everything, in every dimension it is normal in size, but they basically appear larger because of the smaller size of the jaw. Okay, so this is relative macrodontia. The last type is localized macrodontia. It basically means a single tooth or a regional tooth of larger sizes. So there may be only one teeth or few teeth, okay, that are close to each other, adjacent to each other, that are larger in size, and the rest of the dentition, they are normal. And this may be because of gemination or fusion of the tooth bud during the dental development. So this is localized macrodontia. Now here are a few pictures of the macrodontia. In the first picture you can see a generalized macrodontia in a patient suffering from Rebsen-Mendenhall syndrome. So here you can see that each and every of the dentition, the tooth, they're larger in size, they have abnormal shape, abnormal morphology, the color, everything is different, okay? And in the second diagram, you can see that just the upper anterior incisor, the central incisor, they are larger in size, okay? The rest of the dentition, they are normal. Here you can see how large the teeth is, okay? The central incisor. This is little bit larger, but this is very, very large. You can see it's so large. It's anesthetic. It's unpleasing for the patient. Patient have concern about this dentition, okay, when they're abnormal size, because it is notable, okay. So this is an example of localized macrodontia, and this is an example of generalized macrodontia. Now, what are the options? What are the options for macrodontia? There are 3-4 options that you can do to treat the condition. Number one is either do extraction, or you can do teeth shaving. You will reduce the size of the tooth element using the handpiece and special kinds of burr. So this is called as teeth shaving. Or you can do orthodontic if the tooth size, they're larger but they're acceptable. But what's going on is basically when the the jaw, the mandible or the maxilla, they're of normal size, but the tooth, they're of larger size. What happened? They occupy more spaces. Because they require more spaces, they lead to crowding. So sometimes if extraction is not recommended or any other treatment option is not recommended, meaning we want to save the tooth, that's the option. So what the orthodontics they will recommend is to do expansion of the arch, if that is possible, like palatal expander. And then they will use braces, okay, in order to align the teeth, okay. Sometimes you can reduce the proximal surface of the teeth, okay, which also come in teeth shaving. And these are the few options for treating the macrodontia, and that's it. Thank you. I hope you understand. If you don't understand, if you want to ask anything about something, okay, you can write the question in the comments and give like and subscribe my channel. Thank you, and we will meet you in the next topic. Okay, goodbye.